Today, over 350 million people live with viral hepatitis. Every 30 seconds, someone loses their life to a hepatitis-related illness. But does it have to be that way? With a vaccine and effective treatments for hepatitis A and B, treatments for hepatitis D and E, and a cure for hepatitis C, we can eliminate hepatitis as a public health threat by 2030. To help understand this better, we have with us in the studio the President, World Hepatitis Alliance, Danjuma Adda. He is the first black president of the organization. Good morning and welcome to Daybreak on Trust TV.
Thank you for having me.
All right, so let's start. For the sake of those who have no idea what hepatitis is, can you tell us what is hepatitis and what are the different hepatitis viruses that we have?
Yeah, thanks a lot for having me. Hepatitis simply means inflammation of the liver. And it's derived from the Greek word hepa and titis. And like Justice said, it attacks the most vital organ in the body, which is the liver. And then the liver is just like what an engine is to a car, an automobile. And you have this virus that attacks the liver and makes the liver unable to perform its duties that it's supposed to perform naturally, which is detoxification, metabolic activities, and what have you. Now, while a lot of things could cause the liver to be inflamed, like toxins, chemicals, drugs, but the one that is of public health importance is viral hepatitis, which is hepatitis, inflammation of the liver caused by viruses. So viral hepatitis is the one that is the disease of global public health concern. It is a very slow progressing disease of the liver that often will not even show symptoms for majority of people that are even chronically infected. And that is why it is called the silent killer. It's really taking up the liver cells, but you might not even know because the liver struggles to recreate its cells and then make the body healthy. So it takes very long time sometimes. And that's why a lot of people who are living with the disease still live very risky lives because they are unaware that they have this disease that has the potential to end their lives and is causing harm to the liver. So it's a very slow progressing disease of the liver that could lead to what is called fibrosis, cirrhosis, or liver cancer. It is, for hepatitis B, it is the leading cause of liver cancer. And you know, even if it's Joe Biden today that has liver cancer, the best Medicare he could get is to get liver transplant. That's the best he could get. And look at how it is. Like you said, 30 seconds, one person dies from this disease. And it's a disease that is preventable, a disease that is curable for hepatitis C. And it really shouldn't be so because it's something that we have solutions to, but unfortunately it's not available for most people.
Okay, but looking at the enormity and how dangerous this disease actually is, a lot of people actually believe it's not being given the kind of coverage, or people are actually not aware. The awareness behind hepatitis is not like what you can compare to maybe like HIV or any other. Why is that?
I totally agree with you. And that's why I'm happy to have this privilege to be in your studio to share this. 5, 6, 7 years ago, you barely could go to a hospital and see data. Go to date registers, you can barely see any record to say this person died of hepatitis. But you will see registers showing you someone died of AIDS, died of malaria, or tuberculosis. So the lack of evidence to show cause of mortality, the lack of data to show that people that are having bloated stomach, ascites, or yellow eyes is caused by hepatitis. So this contributed significantly in not motivating key policymakers to make decisions because there's no evidence to show the modality or the morbidity or what have you, unlike HIV and AIDS. So, and again, because of the slow nature of the disease, and the associated symptoms, which is very similar to the normal malaria or typhoid, you discover that most people take it for granted and don't even know. So the lack of awareness is something that transcends from, in fact, healthcare workers, policy, to the general community. So what has significantly contributed to that has been the lack of evidence and data to point to the morbidity or mortality, telling you that so number of people die because of this disease, unlike what we've had in HIV and AIDS. And that has really contributed to the lack of investment and lack of interest by even the largest donors currently now on hepatitis, unlike HIV. In fact, hepatitis we usually say it's like an orphan, but the billions and millions are pumped into other diseases, which are equally important to address anyway, but then leaving out what kills one person every 30 seconds. So it's really appalling, and honestly, it's something that some of us over the past 10, 15 years have been pushing and shoving to see that we get the attention of relevant partners, either at the global stage or locally.
All right, so tell us about how challenging or interesting it is, being the first Black president of, World Hepatitis Alliance.
Well, thank you. The World Hepatitis Alliance is the global, the largest international network on hepatitis. It's a membership-based organization. We are in over 100 countries and in over 300 members. Honestly, it came with a lot of responsibility. The first from Africa being there. And rather than just having it as a means of euphoria system, but the enormous responsibility of carrying the burden of the over 300 million people living with hepatitis globally. And then coming from a region that is so lacking behind. Africa is one of the regions that accounts for the new infections of hepatitis, over 1 million in 2019, 2020. So when I was appointed or elected last year and assumed the duty this year, it comes with a lot of responsibility to say, hey, you have to amplify the voice of these millions that are left behind. 2014, 2016, I was executive board member representing African region, and then last year I was elected and I assumed the duty this year. So it comes to that responsibility to say you have to move the organization to the new level, and then building on the successes of the past leaders of the organization, which is not quite easy to break through, especially coming from a region like Africa, and then of course from Nigeria, where we've had some little bit of political will, but less of political action and commitment in terms of really rolling out programs for the masses. And then over 20 million people in Nigeria living with this disease, and over 90 million from Africa. So it's really a thing of great concern to me. I lost my mom to hepatitis C in 2007. So for me, it reminds me every day of the responsibility to really amplify the patient, the voice of the patient, and the marginalized communities that needs help and really needs interventions.
And now let's get back to the disease itself. You made mention earlier about the lack of data that actually caused a huge dent in promoting, or let's say creating awareness when it comes to hepatitis. Yeah. This data is currently being available now.
Yeah, efforts have been made by the WHO. I'm happy to say Nigeria is benefiting from that. Currently, about 6 states are piloting the use of the tools. What contributes to that is a lack of tools. What it means, like reporting documents in the hospitals, where you get tested and there's a form to fill where the results are. Someone is admitted, there's a form to fill what is the cause of that admission. It's treated, and then someone dies of cirrhosis. It is there on the record to say he died of hepatitis B-related cirrhosis. So before now, we didn't have all those tools. So, but I'm happy that the WHO, World Health Organization, the Nigeria Country Office, supporting Nigeria government, we've been able to develop those tools, and they've been piloted in like 6 states in Nigeria. So that hopefully will contribute towards beginning. All this while, we've had a lot of anecdotal data here and there, and some published data to show prevalence. And that's why from the NICE report, we know that we have 8.1% prevalence of hepatitis B, 1.1 for hepatitis C, which translates to like about 20 million Nigerians. So we are getting there. It's not quite easy. And then Nigerian government now relies more on the foreign partners to support in the hepatitis space. The WHO is doing a lot. Clinton Health Access Initiative is doing a lot. The World Hepatitis Alliance is also supporting in one way or the other in advocacy and hopefully resource mobilization.
Earlier you actually talked about cirrhosis, right? All right, so who is more likely to, develop cirrhosis after being infected with hepatitis? So
the age at which one gets infected goes a long way to determine the development of chronic hepatitis. 90% of people that get infected from childhood will develop liver complications. And out of this, about 25% might ultimately have liver cancer. So getting hepatitis at an earlier stage increases the risk of developing cirrhosis. Cirrhosis is a stage of the liver disease where the liver is having what is called decompensation. It's unable to recreate the cells. It's unable to remove the toxins. The scarring, the wounds, because the virus fights it and the immune response fights it, so it's unable to really do what it's supposed to do. So early infection from childhood increases the risk of progressing from fibrosis to cirrhosis or liver cancer. So, but just about 5 or 10% of people that get infected as adults might develop complications because, like I said earlier, it's a slow progressing disease of the liver. So, but people that get infected from childhood have more chances of developing liver complications and most likely liver cancer. And majority, in fact, about 15% might develop liver cancer before the age of 30 or 40. So that is why currently now we're so much pushing for what is called hepatitis B prevention, HBV PMTCT, because hepatitis B could be transmitted from mother to child. So the global trend now is we should have a generation of children that should be protected from getting hepatitis infection, because getting infected from childhood increases the risk of developing liver complications later in life.
Okay, but what role does genotype actually play, in hepatitis?
Nothing at all. Nothing. Okay. It's just that the hepatitis are different classes. For hepatitis B, we have different genotypes, but that really doesn't play any significant role in developing liver complications. So genetic information of humans or people doesn't really have anything to do with the mode of transmission, because the mode of transmission is much the same like HIV. In fact, hepatitis is 50 to 100 times more infectious than HIV, and so it's much more infectious than HIV. So, but genetic information doesn't have much to do with it.
All right. So let's talk about. We've been talking about how there's a lack of awareness concerning this. So right now in the small time that we actually have, can you just give us a brief on the different types of hepatitis that we have, and maybe you just talked about mother-to-child transmission of Hep B, I think. Yeah. So how can the others be contracted as well? Because you just said it's more infectious than HIV.
It is, yeah.
So how is that?
So there are 5 types of viral hepatitis: A, B, C, D, and E. Okay. And out of these 5, only 2 develop chronic condition. Chronic condition just simply means a condition above 6 months, a positive condition above 6 months. So majority of people develop what is called acute condition. For hepatitis A, it develops mostly only acute hepatitis A, meaning it doesn't go beyond 6 months. So, but it has a safe vaccine, and it's self-limiting. It affects mostly only children, and the mode of transmission is fecal, open, poor sanitation, poor hygiene practices for hepatitis A, and there's a vaccine. If I don't ask, you don't even need to worry yourself about that, because it's self-limiting. It can go on its own even without treatment. But the one that causes more sickness, that's morbidity and mortality, which is death, is hepatitis B and C. Hepatitis B, it's really a DNA kind of disease. It causes chronic condition, meaning a persistently positive, what is called hepatitis B surface antigen. That is the first test that is done to detect hepatitis. A persistently positive hepatitis B more than 6 months is an indication of chronic hepatitis B. Now, chronic hepatitis doesn't mean the liver is damaged. It only means it is now the start of the journey towards either liver cancer, either cirrhosis or liver cancer. So it's a slow progressing disease of the liver. Now, for hepatitis B, the mode of transmission is just the same like HIV. On-screen blood transfusion of an infected blood, contaminated needles, sharing needles, and then mother to child, which is one of the key mode of transmission in Nigeria and in Africa. An infected mother could transmit hepatitis B to her baby. And remember, like I said earlier, getting infected from childhood increases the risk of cirrhosis or liver cancer. So, but the mode of transmission is through at birth. That is why the World Health Organization promotes birth dose vaccination. For all babies born should be vaccinated with the monovalent, what is a single shot of the hepatitis within 24 hours of birth, not within 1 week. So now, unprotected sexual intercourse with an infected person, on-screen blood, are all modes by which hepatitis B could be transmitted. It's not contagious, it's not airborne, it's not something you can get casually by handshake or even sharing clothes, but more through body fluids. That is a major mode of transmission, major body fluids. So hepatitis C is almost the same. Hepatitis C is like 50 times less infectious than hepatitis B. But hepatitis C is curable. But hepatitis B has an effective treatment. By WHO standard, it has no complete cure. The treatment is more of lifelong. And that is why people are deceived and misguided around Nigeria. A lot of quacks go on claiming they're treating and curing hepatitis B. And it causes more complications for people, giving them herbal and traditional medicines, which in most cases doesn't cure hepatitis B. So hepatitis B has an effective treatment, but it has a prevention through vaccination. So imagine we have a cancer-causing disease that has a vaccine, but which is not readily available to majority of people. Hepatitis C is completely curable. One of the cancer-causing diseases that is curable, but yet the drugs are not readily available. They are available, not affordable for majority of people. Because in Nigeria, for example, this is not even in the healthcare insurance. It's out of pocket. People will have to pay about 150 to 200,000 to get these drugs that cure hepatitis C. So the mode of transmission is similar to HIV, sharing injected needles and all those. However, prevention is like the same like HIV. Consistent use of condoms, safe blood transfusion, vaccination for hepatitis B. Now there is what is called hepatitis D, which is called Delta virus. Delta virus is more deadly for people that already have hepatitis B. You can't get Delta hepatitis if you don't have hepatitis B. So hepatitis D can be transmitted through hepatitis B. So a vaccine for hepatitis B is another prevention for hepatitis D. Then the hepatitis E is also there, which actually is also causes only acute condition. It doesn't cause chronic condition. It doesn't last beyond 6 months. It goes mostly within the acute phase, which is 6 months. So any persistent positive surface antigen beyond 6 months is an indication of chronic hepatitis B, which is now the onset of the journey to cirrhosis or liver cancer. And all that we try to do, for example, for hepatitis B, is to stop this progression of liver disease, the damage in the liver. What the virus does is makes the liver unable to do what it's supposed to do. And the liver and the immune system begin to fight itself, which now leads to formation of mutation cells, cancer cells, and before you know it, the person's liver gets the liver cancer, which ultimately leads to death or liver transplant if the person is lucky.
So I believe so. From what you just explained right now, the best way to go is vaccination.
Prevention for hepatitis B.
For hepatitis B.
And early testing to detect it. You detect it early. You have the chances of stopping that progression. It's a journey. So you have the chances of stopping the progression of the disease. And let me quickly say this. One of the issues why we have about this major problem with hepatitis is that it is mostly misdiagnosed, because it mostly presents, for those that have symptoms, majority don't have symptoms, it mostly presents like the common malaria, typhoid. So you go to an average hospital, the doctor might just malaria, typhoid, and would likely not ask for hepatitis testing. So, and most people are delayed to start treatment. By the time they now come back, complications might have set in. So that is why we have a lot of gaps in even healthcare workers' knowledge and skills to manage hepatitis properly.
So basically, when I go to get tested, when I go to a hospital to get tested, I should ask for
People
hepatitis.
should ask for hepatitis testing, even whether it's not free. It might cost less than 2,000. So ask for hepatitis testing. Even it might not be provided by the hospital, but what does it cost to pay for 2,000 testing that you know about a disease that could cause you liver cancer ultimately?
Okay. All right, now, earlier you talked about, hepatitis being transmissible. Now, how can healthcare workers actually protect themselves, from exposure?
Healthcare workers, there are two ways to this. Healthcare workers need to protect themselves for their health, and if they're also infected, they need to protect the patients in the context of injection safety. So there is a policy by the WHO and I think the federal government of Nigeria to vaccinate all healthcare workers, but sadly that is not being done. Ideally, and every healthcare worker is supposed to know their status, and if they're negative, they should get vaccinated for hepatitis B, because there is a risk of the healthcare worker also transmitting to the patient. If there is maybe a cut or an exposure, the patient could also, and again, maybe through dental procedures in the hospitals, if those tools are not properly sterilized. We've had cases of those things sometimes outside Nigeria. Even in Nigeria it happens. If equipments in the hospitals are not properly sterilized, they stand the risk of transmission to patients. So healthcare workers should first of all test themselves. If they're positive, they should seek treatment or seek care. And if they're negative, they should get vaccinated as a way of protecting themselves and protecting the patients they manage or they attend to.
So you made mention of the medication that is not readily available.
Yeah.
You said, so what about the vaccine?
Is
that readily available?
Vaccine is everywhere. The vaccine that are given, primary healthcare agencies have the vaccines they give to children and equally can be given to adults.
Okay.
But the question is it affordable? Is it free? Which is not, unfortunately.
So
the one for babies is free.
Okay.
But unfortunately, women that deliver outside hospitals, their babies miss out that chance of getting vaccinated. And that's why we promote maternal and child health. All women should deliver at least in hospitals. And the vaccine should be given to all babies within 24 hours of birth. There should be no excuse that the woman put to birth 10 midnight. The vaccine is very stable. Let me say this. The hepatitis B vaccine is one of the most stable vaccines that can stay outside cold chain for even 3 days. So even outside the cold box, it can still stay. Women that deliver over weekends, there's no excuse to say that the vaccine is not available. The vaccine should be in the maternity ward where every woman that delivers should have access to that vaccine. And what about private hospitals? That is where there's a huge problem because people that deliver in private hospitals, the babies may not have that. So that is a demand. In fact, it's a fundamental right of every baby. Remember, imagine a baby coming out to the world and getting infected with a disease that could have been prevented with the same vaccine. So vaccination is very crucial. It might not be free for others, which is adults or the healthcare workers, but like I keep saying, health-seeking behavior is very crucial towards most of these, preventing most of these ailments. Even if you're asked to pay, what does it cost for you to pay for a cancer prevention disease if you get the shot? And let me quickly say this. The shot of the vaccine is supposed to be over a period of 6 to 8 months. You get the first shot today. After 30 days, you get the second shot. And the third shot is supposed to come 4 to 5 or 6 months after the second shot. People are misguided and giving the vaccines consecutively. The body is supposed to have enough room after the second shot to build immune response. So you're giving the third dose after 4 to 5 months, not 3 months consecutively, as it is being done in most places.
Okay, so finally now, does the vaccine, does it have a lifespan? If I get the vaccine,
the vaccine is supposed to be for life.
Okay.
But getting it earlier stage, the potency is more, and sometimes body mass index also could determine that. But it's always advisable from childhood. It's supposed to be for life. The idea of booster dose after 10 years doesn't even suffice. The vaccine is supposed to be for life.
All right, thank you so much, Dr. Njama-Adda, for your thoughts and everything you've actually shared and your enlightenment on hepatitis today. Thank you. All right, with that, we've come to the end of Daybreak this beautiful morning. Thank you so much for tuning in. We'll be back again tomorrow, same time, same station. I'm Dashan Hussaina Usman. Have a blessed week.
Well, just like you said, tomorrow is another day on Trust TV for Daybreak. I am Ibrahim Yusuf. Thank you for joining us.